So Kelly, I'll be your student nurse today. I'm going to be performing a bed bath on you. Is that okay?
Yes.
Can I confirm your name and your date of birth?
Shane Arvin, January 10th, 2000.
Deal. Okay, and then I would perform hand hygiene and put on a fresh pair of gloves. So first, I will fill 2 basins of water, one with plain water and one with soapy water. I'm going to have her test the temperature to make sure it's okay.
Feels great.
Cool. Okay, and then I will throw in a bunch of washcloths into the soapy water and plain water. And I'm going to put a bath blanket over her and take this comforter off so we can, could you hold that for me?
Yes.
So we can not expose her. Don't want that to happen. Fold it down. And then I will take it off the bed so it does not get soiled. Okay. Now I'm going to start with the plain water and get a rag out of there and take my washcloth and make it into a net. I'm also going to set this dry towel on her chest to make sure it doesn't like get her wet. Okay, plain water. Dunk. I'm going to go from inner eye to outer eye, inner eye to outer eye, from the forehead to the chin, forehead to the chin, and using different corners of my rag. And then I'm going to do her neck area using a different corner. And then I will throw that back in. We will dab her face off and dry it off. And then I'm going to change my gloves and move on to her arm. I'm gonna have her stick it out so we can put this dry cloth underneath, and then we'll lay it down. Then I will get a soapy rag and make it into a mitt. And we'll start at the wrist, going distal to proximal, using long strokes. Then we'll get her armpit, and then we will go get each finger and get the nails if they are dirty. Make sure to get under them. And I'll have her set that down, get a rag that's plain water, and do the same thing. Armpit, just to make sure there's no soap left over. And then, and then we will dab dry on the arm, and I will lift this up and cover that back up, and we will move on to the other side. We'll expose this arm and get a soapy washcloth, fold it into a mitt, and do the same thing with soapy water. Distal to proximal, long strokes. Get the armpit, the fingers, and under the nail beds. And then I will lay it down, get a plain wash rag, change it out, and get plain water, and go distal to proximal. Get the nails and the nail beds, and then I will put that down in the bin and dry her arm off. Take this, and I will get a new pair of gloves and get, actually I am going to put this down. Then I'll get a new pair of gloves and we're going to do, I'm going to put this down here. Is this how it is? And I'm not going to expose her, but I'm going to get a soapy rag after I have changed my gloves and get her breast area, get a just plain water rag and wash the soap off of the breast area and under the skin folds. And then I'm going to get another soapy washcloth and get her stomach area and under any skin folds if there are any. And then I will get a plain water rag and be using my different corners and get her stomach area while keeping her covered to keep her covered. Now, throw that out and dab her dry using a dabbing motion. And I'll take that, cover her back up for her dignity, and then I will move on to her leg. We will expose one side of her leg. I will put this back up, and I will change my gloves. And we will only expose one leg. So then I will lift this leg up and put this under it. Dry, okay? And I will use a soapy washcloth using all four corners of my mitt, starting at the ankle and going all the way up using long strokes, distal to proximal, different corners, switching it over, different corners, and then I will get a plain one, and then I will get a plain one and wash the soapy water off using my different corners, going distal to proximal and long strokes again, and I will dab that dry. And then I will be making sure to get the feet with a new soapy washcloth as well, get in between the toes, and then rinse it off with a just regular washcloth that's just regular water. And I will dab that dry. Then I will take this out and cover her back up. I will move over to this leg. Oh, okay. Excuse me. And I will uncover this leg only. And she's pretty good at lifting her legs, so she can just do it for me. Also, I will get a new soapy washcloth and do the same motion, distal to proximal, long strokes with soapy water. And then I will get her foot, soapy water, and then I will get another new plain washcloth, which is plain water. Distal to proximal, long strokes, washing that soap off, getting in between the toesies. And then I will throw that in there. Make sure everything is all dry, and take that out from under her and cover her back up with her bath blanket. Then I will have her turn and roll over to that side. Okay. And I will take it like this, so we can have this covered up behind. And I will get new gloves. And I'm going to put this down actually, and then I will get new gloves. Don't want to dirty ourselves. And I'm going to uncover her back only and tuck this under there so it doesn't get too wet. And I will get a soapy washcloth, getting her back first and going down. We will go down in long strokes, getting her back using all four corners of my washcloth. Then I will get a plain water washcloth and do the same thing. Then I will dry her back, cover it up, and then I will uncover her butt and get a new soapy washcloth and go down and up. And then I will get a just plain water washcloth and do the same motion, dab her butt, and cover it back up. Then I will get new gloves, take this towel out, and we will be doing a bed change if that is okay with you.
Yes.
Was your bed bath everything you thought of? And
It was perfect.
okay. Okay. So we will be changing the sheet. we'll start over here. Tucking it, making sure she's comfortable. And rolling and tucking under her body. Making sure nothing gets dirty. I will take the inside of my hand and tuck this into this corner. A long sheet. And take it and tuck it into this corner. And then I will take our chuck pad, make sure we get a new one of those, and we are going to roll it, roll it, roll it, roll it, roll it more, and put it under the old sheet. And make sure they know that they're gonna have a hump to roll back over.
Yeah.
Okay, now I will have you roll. Do not move your hips, please.
Put the thing up.
Okay, I will put this up. And I will change my gloves since I touched that. And I will move to the other side. I'm going to put this down. Get new gloves. And I'm going to roll the dirty sheet out. And put it into the hamper. And I'll take this, roll it out from under her, and put this. I will also be getting new pillowcases. And then she can roll over onto her back. I'll put this back up for her safety. And then I'm going to put a new gown on her. Right? And then I will put her unsoiled comforter back on top of her. And we will tuck this in a second. I'm going to take the back blanket down. And put that in the soiled hamper. And then I'll ask her if she likes her feet tucked.
Yes.
And we're gonna take this and drape this. I'm going to tuck it. And tuck it under. And do the same thing with the other side.
Good.
All done. Everything
Thank
all
you.
good?
Yes, thank you.
I will throw my gloves away in the trash can and perform hand hygiene. Goodbye, patient.
Bye. Nice meeting you.